In May 20th, 1994, I had a sudden cardiac arrest. I did not feel that anything was the matter with my heart just before and I didn't know I had any heart problems. We were on our way to go to my daughter's graduation in Madison, and I just collapsed. Well, I know I died, pretty much. And all I think about is just, thankfully, I do have a Medtronic implantable defibrillator. If my heart is going very rapidly, I know I'll kick in and we'll get it going. So it's like my guardian angel, I call it.
You may be one of the many thousands of people each year, like Vivian, who learn that they are at risk for a fast, chaotic heartbeat that can result in sudden cardiac arrest. You may be feeling fine and not have any symptoms of heart disease, but you still may be at risk of sudden cardiac arrest. Fortunately, there is a good way to protect yourself. A device called an implantable cardioverter defibrillator can help keep you safe 24 hours a day. A healthy heart beats in a regular and coordinated way at a rate between 60 and 100 beats per minute to pump blood to your body and brain. However, heart disease can cause your heart to suddenly start beating very fast and quiver instead of pumping blood effectively. If left untreated, this rapid heartbeat can cause sudden cardiac arrest and may lead to death in minutes. Many different conditions can put you at risk of sudden cardiac arrest. These include if you have heart failure, if you have a heart that pumps poorly, if you have had a heart attack, if you have survived an episode of sudden cardiac arrest, or if you have a family member who has experienced sudden cardiac arrest. It's important to take appropriate action as soon as possible because sudden cardiac arrest can happen at any time. There is no way to predict when it will occur, and there are no specific symptoms or warnings. This program is designed to help you learn more about sudden cardiac arrest and how implantable defibrillator therapy can provide life-saving protection. The program is intended to provide you with helpful information, but should not be used as an alternative to speaking with your doctor. Be sure to discuss specific questions and treatments with a medical professional. This program is divided into 8 chapters. Chapter 1, Introduction. Chapter 2, Facts about sudden cardiac arrest. Chapter 3, What is an implantable defibrillator? Chapter 4, Learning that you're at risk of sudden cardiac arrest. Chapter 5, Making a decision about an implantable defibrillator. Chapter 6, The implant procedure. Chapter 7, Follow-up monitoring. Chapter 8, Life with an implantable defibrillator. During the program, you will learn more about Vivian's life and how implantable defibrillator therapy has affected her and her family. You will also meet Ian and John, 2 other people who have been helped by implantable defibrillator therapy, and hear from Dr. Angel Leon, a specialist in heart rhythm problems and implantable defibrillator therapy.
What the main concern is for me and my condition is that at any given moment, my heart can go into an arrhythmia that is a lot of the times the reason for sudden cardiac arrest, and my heart can go in arrhythmia at any time and, quit working, basically.
Sudden cardiac arrest is the abrupt loss of the pumping function of the heart, so that the heart stops pumping blood to the body. A person can lose consciousness quickly, and if we don't reverse what caused the heart to do that, a person can die within minutes from a sudden cardiac arrest.
Sudden cardiac arrest, or SCA, is a leading cause of death in the United States. It affects men and women equally. About 335,000 people die each year of sudden cardiac arrest, according to the Heart Rhythm Foundation. To put that number in perspective, more people die from sudden cardiac arrest in the U.S. than from breast cancer, lung cancer, and AIDS combined. SCA is commonly mistaken as a heart attack and is not well known. Sudden cardiac arrest happens if your heart suddenly starts beating very fast and quivers instead of beating in a regular and organized way. Very little or no blood gets pumped to your body and brain. If left untreated, sudden cardiac arrest may lead to death within minutes. You might think that sudden cardiac arrest is similar to a heart attack or myocardial infarction, but it's not.
A myocardial infarction occurs when a person gets a lot of chest pain. That chest pain is usually a sign that there's a blockage in a coronary artery, so that if you had a cholesterol plaque in there that suddenly ruptures, a blood clot forms in that artery that prevents blood from flowing to the heart muscle. The biggest symptom from that is heaviness in the chest, sometimes going to your shoulder, sometimes to your jaw. When the artery closes off and blood flow to the muscle stops, the muscle can become damaged. And that's what we call an infarct. The most common cause of sudden cardiac arrest is a very rapid, erratic heart rhythm, known as ventricular tachycardia or ventricular fibrillation. Either one of those cause the heart to fire so rapidly that it becomes almost paralyzed. It can't pump blood. So then what happens is, when you don't pump blood, the brain doesn't get any blood, the rest of the body doesn't receive any circulation, and people collapse. And if you don't reverse what started it, people die.
Defibrillation corrects the heart rate to its normal rate with an electrical pulse. There are two types of defibrillators. Emergency medical technicians carry and use automatic external defibrillators. External defibrillators may also be located in public places such as schools, auditoriums, and on airplanes. A small device implanted under your skin, called an implantable defibrillator, can also correct your heart rate and save your life. An external defibrillator must be located nearby to be used in time to be effective. An implantable defibrillator is always with you and can deliver life-saving therapy in seconds.
Sudden cardiac arrest has been around as long as there's been heart disease. In the past, we knew that people were at risk for it, but we really didn't have good scientific information to tell us what we could do to prevent it. Within the last 5 years, there's been 2 major, large clinical trials that have shown us that we can prevent sudden cardiac arrest in those groups that we know are at increased risk.
Fortunately, an implantable defibrillator is a good way to protect yourself from sudden cardiac arrest. An implantable defibrillator remains on call, monitoring your heart rhythm 24 hours a day, ready to help you should you need it. Ian is only one example of the many hundreds of thousands of people worldwide who are being protected from sudden cardiac arrest thanks to their Medtronic implantable defibrillator.
The implantable defibrillator is a device that was invented and introduced almost 25 years ago. It consists of a device that has a wire that goes into the heart and records the heart rhythm. When the electronics in the defibrillator recognize that the heart rhythm has gotten out of control, it then recognizes it and intervenes to return the rhythm back to normal.
An implantable defibrillator is a pacemaker-like device about the size of a pager. An implantable defibrillator is usually implanted under the skin in your upper chest. The battery and computer circuitry needed to correct your heart rhythm are contained in the device. Thin insulated wires called leads connect the implantable defibrillator to your heart. Typically, the implant procedure is done under local anesthesia. It does not require open heart surgery, and most people go home within 24 hours. An implantable defibrillator monitors your heart rhythm. If it detects a problem, it will use electrical pulses to correct your heart rate. Depending on how it's programmed, an implantable defibrillator can first use small, painless pulses to correct your heart. If these don't work, a stronger shock is delivered. A shock can be surprising and uncomfortable, sometimes even painful, but the feeling passes quickly. Sometimes it's over before you are fully aware of what has happened. People describe their experience with a defibrillation shock in different ways. For Ian, receiving a shock was a painful and memorable experience. For Vivian, the shock was startling more than anything else.
What happens when you receive a therapy from this device is that it sends a jolt of energy to your heart because it has recognized that it needs some help to convert itself from what we call as arrhythmia associated with sudden cardiac arrest. And the jolt that sends is extremely painful. I mean, you feel it from your head to your toe.
I've had two shocks that were sustained. The first time happened maybe a year and a half after the implant, and I was out walking with my husband, and as we were walking, all of a sudden I felt just maybe lightheaded. I was just going to tell him to let's slow down a little bit. Instead, I landed on my knees. It went off. First, my husband thought I had tripped, and I knew right away it went off. My defibrillator went off, and all I kept saying is, didn't you hear it? Because to me, it sounded like a cannon, because it's very loud to me. But he says, no, I wouldn't have heard it. But when I went off, the only thing I felt was it scared me, but it did not hurt at all. There was no pain at all.
Although a shock may be painful, you know the device is there doing its job of providing you with life-saving therapy.
Before I implanted the defibrillator in any of our patients, I actually tell them very bluntly and very clearly that this device is designed to save your life. And in saving your life, it's got to do it by delivering one of these shocks and one of these jolts. And I'll be very happy to hear you complain about it after it saved your life, because otherwise you wouldn't be around to complain.
My mother and my father were definitely surprised about the condition, and they took it in stride. My mother is a nurse, so she had the ability to kind of understand that probably more so than myself. So they took it probably even better than I did, and just knew that we were going to have to work with the cardiologists in the medical community to understand what it was that I was going to need to do to optimize, my lifestyle based on the condition that I had.
Many of you watching this program have been living with a heart condition for some time. Some of you may be recently diagnosed. Either way, it may come as a surprise to learn that you are at risk for sudden cardiac arrest and that you may need an implantable defibrillator to protect you. It's the same way for many people. Ian was an energetic student when he found out he had a serious heart condition.
I started playing football when I was 8, and so it was something hard for me to grasp. I didn't necessarily listen to some of the advice that was given to me in the beginning, because at that age, I still had my whole life in front of me, and I understood I had this condition, but was anything really gonna happen to me was the attitude I took.
John was an active family man holding down 2 jobs when he was told he had a heart condition that put him at high risk for sudden cardiac arrest.
My health was really excellent. I was able to actually work 2 jobs for a long time. When my situation caught up with me with my heart problems, I was working a lot of hours, working 12-hour days, 7 days a week. So it came as quite a surprise when I found out that indeed I had congestive heart failure.
Like John, you may be feeling good and wondering why your doctor has recommended an implantable defibrillator. You still may be at risk for sudden cardiac arrest, even if you had a heart attack years ago and have few, if any, symptoms.
One of the most commonly asked questions that I get from patients has to do with the fact that they had their infarct or their heart attack years and years ago, and they've been doing well and they otherwise feel good. And they wonder, since they're doing so well, why are they at risk? I tell them that sudden cardiac arrest usually has no warning signs and has very few symptoms associated with it. And a person could be doing great 1 second and can collapse the next. And the fact that they've been doing well really doesn't necessarily decrease their risk.
Your doctor may have recommended an implantable defibrillator.
I think it's natural to be nervous when we tell you that we're going to put one of these devices in you. On the other hand, I like to approach it by telling patients that this device is really the most effective security blanket that a patient can have to prevent them from dying suddenly.
In general, most people who are candidates for an implantable defibrillator have one or more of the following risk factors: heart failure, a heart that pumps poorly, a prior heart attack, a prior episode of sudden cardiac arrest, or a family member who has experienced sudden cardiac arrest. Ian was an athletic student who was quite concerned about how an implantable defibrillator would affect his life.
Well, when I was told that I needed this defibrillator, I was not happy. And I was probably, at that time, probably more rebellious about that than anything else, because I really wanted to know, how this was going to affect my life. Now I've got this, this device in my chest that you're going to be able to see, how am I going to feel about not wearing my shirt on the beach, swimming, running? How am I going to feel about, individuals knowing that I have this at such a young age? This is has been a private matter to me for a long time in my life anyway. So now that this is going to, open the world up to my condition, and it really didn't sit well with me in the beginning.
At first, Ian was resistant about his need for an implantable defibrillator to protect him from sudden cardiac arrest. He was young and thought he was bulletproof. After he was hospitalized for 2 episodes of a heart rhythm problem and had a number of discussions with an electrophysiologist, Ian decided that an implantable defibrillator was the right choice. Although John had participated in a number of clinical studies of heart failure medications, he had never heard of an implantable defibrillator when his doctor told him about the heart device. After his doctor explained the benefits, he quickly decided to go ahead.
Actually, the choice to have the defibrillator done for me was not really that tough of a program. Once I got with the knowledge of what it would do, how it would operate, that there is very minimal amount of discomfort when they put it in. I ask a lot of questions. I read the brochures. I talked with my family, and they backed me 100%. I live out in the country. It's pretty obvious that I'm not close to any medical care. Now, we do have first responders. We do have access to ambulances and what have. But you're looking at best case scenario, being in a rural area, they're probably about, and they would say this if they were at the station, about 11 minutes away.
Making a decision on whether to get an implantable defibrillator is a very important one. If you decide to go ahead with implantable defibrillator therapy, the specialist who will implant the device will work with the doctor who manages your heart disease to coordinate the care of your heart. You will still need to take your medications as prescribed and have your implantable defibrillator checked regularly.
If a friend needed a defibrillator, I would definitely say, yes, you have got to have a defibrillator implanted in you because it's available now. It will save your life.
In considering an implantable defibrillator, you may be wondering what the implant procedure is like and what happens afterward. This chapter will give you a better idea of what to expect. Typically, the implant procedure is quick, low risk, and usually done under local anesthesia. It does not require open-heart surgery, and most people go home within 24 hours. The implantable defibrillator is implanted under the skin in the upper chest. A small incision is made, and insulated wires called leads are guided through a vein and into the heart. The leads are connected to the defibrillator, and the device is programmed to meet your needs. It is then tested to make sure it is working properly and inserted into a pocket under the skin. The incision is then closed with stitches.
You know, the procedure actually ended up being much easier than what I expected, much less aggressive than what I expected. You know, there was no open heart procedure. They made a small incision in my pectoral area and did everything as far as insertion of the leads and the device from that area. And it was much, you know, less, I guess, intimidating than what I had expected from the procedure.
There are some risks involved with an ICD system implant surgery that we would like you to know about. The risks include, but are not limited to, infection at the surgical site, sensitivity to the device material, failure to deliver therapy when it is needed, or receiving extra therapy when it is not needed.
But I was quite surprised that as far as pain goes, there was very little pain involved. It's probably one of the easiest procedures that I've ever had.
By about 2 weeks, we let patients get back to doing whatever they want to do. The only restriction during those 2 weeks are really not lifting heavy weights, not moving the arm where the device is placed too much. But aside from that, there really are no restrictions.
After the implant, recovery will take about 2 to 6 weeks. You will still need to follow your doctor's advice about eating, exercise, and good self-care. You will also have to take your medications as prescribed and have your implantable defibrillator checked regularly. Based on your health history, your doctor will determine what restrictions are appropriate for you.
We have to remember that the defibrillator is designed to treat sudden cardiac arrest. The defibrillator is not a substitute for medicines that we use to treat high blood pressure, congestive heart failure, or elevated cholesterols. So when a defibrillator goes in, we don't mean it as a substitute for proven medical treatment. Our patients still have to continue taking those medicines. That's very important.
An implantable defibrillator is designed to protect you from sudden cardiac arrest. To help ensure that your implantable defibrillator is operating properly and programmed in a way to best meet the needs of your specific heart condition, regular device checkups are necessary. There are several different ways to perform device follow-up. One way is to have it checked in the clinic of the doctor who implanted your device. During an office follow-up visit, your doctor or nurse will use a programmer to communicate with your defibrillator to collect information about how your device has been functioning. These include whether your device has delivered any therapies and whether the battery is working properly, as well as other information that may be helpful in managing your heart disease.
I have my defibrillator checked. I believe it's 3 or 4 times a year. The clinic always lets me know when I will be getting it checked.
Because travel to the clinic may be inconvenient or difficult for some people, Medtronic has developed technology that allows patients to conveniently send information from their heart device to the clinic using a standard phone line.
When I use the monitor, it's very simple. The directions are very simple. You just plug the monitor in and also into the telephone outlet.
The doctor who implanted your heart device will discuss how and when device follow-up should take place. It's important to have your heart device checked regularly, either in the clinic or remotely, as directed by your doctor or nurse.
Can I go out there and actually play basketball with the boys and maybe get a little bit physical, push myself to the max a little bit, take that extra step or two down the road to walk with the boys when we take the dogs out and such. So those are one of the things that I can enjoy and not have to think about, am I gonna take a walk down the road and be able to come back?
I live with the device like I don't have the device, really, because I really, like I had mentioned before, I really don't know that I have it unless I see it, you know, when I'm swimming or things of that nature. It does not get in the way. So I do everything that I used to do for the most part.
Each person's experience is different, but after you heal from the implant surgery, you should be able to pretty much go about doing the same things you did before the implant.
We don't want them lifting heavy weights. We don't want them using their arms excessively. But once the device is in place and once the incision heals, we tell people to go on and to enjoy their life and do whatever it is that they'd like to do. We tell people to travel. We tell them to exercise. We tell them to continue working. These devices are intended to let people go on with their normal lives, and that's what we want them to do.
Having an implantable defibrillator provides security in knowing that it's there to correct your heart rhythm should you need it. Your implantable defibrillator may deliver a shock to your heart if it detects a problem.
If a device goes off once or twice, I try to reassure the patient that a single shock or 2 shocks within a very short period of time really do not require that they go driving to the emergency room. I ask them to sit, try to be as calm as possible, and if they're otherwise feeling good, that they should just give us a phone call, let us know what happened, and we'll set up an appointment for them to come in so that we can use the tools that we have to interrogate the device and find out exactly what happened.
I know that if it does go off, I can call. I can call my hospital and right away to let them know. What they usually ask me is what I was doing at the time that it fired off, and how I felt before and how I'm feeling now, and it usually has always. I've always felt fine afterward.
You may have questions about how your activities may be affected by your implantable defibrillator and the types of adjustments that you may need to make. It's important to get accurate and up-to-date information, as there are many misconceptions about things you can and can't do with an implantable defibrillator. Your doctor or nurse can give you more information about the most common concerns people have about implantable heart devices. They can also answer your questions about using items in your home or work environment and what activities you can and cannot do. For Vivian, an implantable defibrillator has given her the opportunity to work in a gift shop, travel with her husband, and spend time with her family.
The device is not a problem at all when I travel. At the airport, I usually I show them my card that says I have an implantable defibrillator. It's not a problem at all. It just makes me feel that I can do whatever I want to do. There's no obstacle, and that I have a guardian angel right here.
It made me feel very safe and secure that if it ever happened again, she was protected. She was, this device would save her, basically.
For Ian, an implantable defibrillator has given him the opportunity to get married, start a family, pursue a career, and his hobbies.
I still operate my car. I can still play with my child. I still do, athletic activities such as golf and jogging and, all of those normal activities. Had it not been for my device being implanted, I wouldn't be here right now to tell you my story about how this has been great for me in my life. And, now I have a child and a wife, and it's just great to be able to have those things that I wouldn't have had before having this device.
Please listen to some additional information Medtronic wants you to know. The patients in this program have described their experiences with implantable defibrillator therapy. Results vary. Not every person responds in the same way. An implantable cardioverter defibrillator, or an ICD system, delivers therapies to treat patients with heart rhythm disorders or who are at significant risk of developing heart rhythm disorders. An ICD is placed inside your body and works automatically. Risks associated with an ICD system implant include, but are not limited to, infection at the surgical site, sensitivity to the device material, failure to deliver therapy when it is needed, or receiving extra therapy when it is not needed. After receiving an ICD system, you will have limitations with magnetic and electromagnetic radiation, electric or gas-powered appliances, and tools in which you are allowed to be in contact. Treatment with an ICD system is prescribed by your physician. This treatment is not for everyone. Please talk to your doctor to see if it is right for you. Your physician should discuss all potential benefits and risks with you. For further information, please call the Medtronic toll-free number at 1-800-551-5544, 7 a.m. to